Welcome back to another episode of the Medtech Business Academy, brought to you by the Medtech Experts. I am your host today, Scott Alexander, and I am joined by three illustrious members of the podcast: the amazing Barbara Strain, the questionable Skender Daerty, and the incredible Mike Sperduti. So we were talking a bit before we started recording about the voices in our heads and how sometimes it should be somebody else's voice. And most importantly, how critical it is to take external market feedback and incorporate them into our businesses so that we can make good, informed decisions about where to take the companies. So we were going to do a little bit to turn the camera at somebody in the organization on the podcast that does a lot of work in this sort of, heck, I'm going to get it wrong, but voice of customer type stuff. And Skinner, have you sort of lay the groundwork, and then we can add on top of it some of the other experiences that the other members have had. I guess, do you mind with a little soliloquy of what is external feedback?
Yeah. So thanks. I'm incredibly fortunate to be wedged between two incredible people with my questionable credentials. So appreciate the introduction there, Scott. Thank you.
It's the least I could do. Yeah. And I won't do any more. So
nobody expects any more, trust me. So thank you. So a core part of our business, so anybody doesn't know, we have a network of experts that we work with, and we have a network of healthcare experts of all shapes and makes and varieties. So we have a lot of physicians, clinicians, nurses, techs, therapists, et cetera. But also within our network, we've added layers such as value analysis, Barbara. We have IT professionals, we have biomedical professionals, we now have finance professionals. Essentially, the idea is anytime an organization is looking to bring an idea, a concept, a thought, a technology, or revamp a strategy, we can offer them an opportunity to connect into real life form with the end users that are going to be making decisions based on the information they're going to present to them. Okay. And that's why we've diversified into IT, biomedical, value analysis, supply chain, et cetera, because the voice of customer today is more diversified than it's ever been before. Right. When I first came into this industry 20 years ago, I was with a company that was selling a variety of physician preference items. And as the title implies, we had to sell a physician. Done. Transaction oriented, right? Well, today, and we've talked about this ad nauseum, and everybody knows, it's a group think process now. There's no longer a decision that really occurs within a healthcare organization that is one person oriented. It is a group and a committee dynamic, okay? Whether it goes through a formal value analysis process or whether it has some sort of committee thought process associated with it, it goes through a committee. And what we find a lot of times is the ability to bring in that group think into your mindset at an earlier stage, whether it be in product development or strategy development, makes you much more apt to adapt to the voices that are out there, right? They're not just in our head, as Scott alluded to, which he has so many. Okay, but outside,
and they all say good things about me, so it's good.
That's so clearly you need help. But
great people, yeah.
But with that component, right? And it's one of the things we just talked to a customer yesterday is people take this voice of customer and they still don't get it right. And what do I mean by that is they say, hey, I've spoken to so-and-so. And here's the pitfalls that we see is A, they either talk to too many people within one cohort and are forgetting that it's a group think dynamic now and have then alienated everybody else. Okay. And what they do with that then is they take the voice from that one cohort and they try to apply it to everybody. Well, guess what? What's bullet point number 1 of priority over here is bullet point of number 7 of priority over here, and vice versa. So trying to take one piece of information and apply it on a generalized basis, it doesn't work. Okay. Second, they either only go to favorable places. Okay. And they get the opinions they want to hear, not the opinions they need to hear. Okay. we always talk about in our organization when we're talking to companies, we talk about the say versus do paradigm, right? If I ask any one of my friends something to get me out of their hair, they may say something to ensure that they don't hurt my feelings or impact the way our relationship is. They may say something, but will they actually do when push comes to shove? And we see a lot of that happening in the marketplace. We see companies come to us all the time. They're like, yeah, we did this. We did a voice of customer. We did a market research activity, 6 months ago, and it came back overwhelmingly positive. And I'm like, okay, well, you're coming to me right now because there's been 6 months, and clearly something has not occurred that you expected to happen. And when we review their questions and we review who they spoke to, we see they got everybody to say the right things, but they never press them on what will you actually do.
So, Skinder, I like to step back for a second.
Yeah.
I'm of the mindset that if I wanted your opinion, I'd give it to you. All right, meaning, I've spent a lot of time inventing my product. I've researched my product. Right, I feel like the reason why I actually put my entire future behind this product was because I uncovered a market need, right? And I guess,
but did
how
you?
many people say that again?
But did you?
Okay, no. But here's my. That's a great question. But so my question is, realistically, right? Do I do the first as I'm going through this process as a startup, right? How many people should I talk to in order to formulate an opinion? And how do I make those choices to make the right choices?
You have to figure out who is going to be involved in the decision-making process ultimately when you come to market, right? So some of the challenges that we see, particularly with startups, is most startups, and this is over characterizing and simplifying it, are usually started by either an engineer or a clinician. Okay. It's an engineer who saw a problem, was like, I'm going to go out there and I'm going to fix it and engineer something to make it. Or it's a clinician who recognized the challenge within their own practice and said, I'm going to take the effort to create something. Either which way, they're great and they have a lot of courage, and it takes a lot of courage to take that first step. The first step is the hardest. Okay. But the challenge, Mike, that we see is they're very thin-skinned in those early days because of the frailty of the situation. They don't really want to hear the answers they don't want to hear. And so we all know the numbers. It takes between $2 million and $5 million to bring a product to market today. That is without selling a single device. And that is mostly regulatory and patent work. If half of these companies would have at least heard that their baby's uglier in their first days, they would have found a way to either avoid the $2.5 to $5 million pitfall, or they would have made some sort of pivot to make the $2.5 million to $5 million well worth it. So, Mike, when you ask who is it that I should be talking to and how many, it's really circumstantial to where you are in the maturity scale. But at the end of the day, you should always be talking to somebody that's at the far end of the purchasing decision. Even though you're in day one of this idea, if you're not talking to the end user committee made up of clinicians, purchasing, supply chain, value analysis, you've done yourself a disservice. Does that help, Mike?
It does. And I guess so. And I also, what I'm hearing too is that it's not even the end user that you need to be concerned about getting their voice. It's the surrounding voices that are also going to weigh in that aren't really even in that department. You also have to figure out how to get through those issues as well.
Yes. There are so many products out there that are clinically relevant that will never get purchased today, right? Anybody that's been in this industry long enough knows those products. Sorry, Barbara.
No, that's okay. Because, Mike, that's the question I usually get asked by various companies. Who do I speak to? Who do I get that input from? So I was on a conversation earlier today where we were talking about the difference between decision makers and decision influencers. And so you've got to know who that is. And that's what value analysis brings to an organization, whether it's a hospital or any other industry using that process. You bring all the key stakeholders, even if they're tangential, because eventually they get affected. It's like the whip of a tail, right? The tail of a whip. I said that backwards, but that's okay. We'll remember it better that way. But it's the same thing, as that's what I get asked a lot. And so I actually talk to sales teams and a variety of folks rather than just internally they're saying, here's the material, you need to go, pitch it somewhere. It's all of the stages to what Skinder was saying. It is, what's the maturity? So I'll get maybe a new company that needs to hear the thing. So you ask that question, but then they'll come back to me in like 6 months, 18 months, whatever it is. Here's where we are now, and here's what's happened so far. So that's a really, really great question, because that's really what people are asking out there.
Well, and the other thing I'm interested in is, when you get all this information and you synthesize it, what I'd be looking for, and is this what I should be expecting from somebody if I were to outsource this work? What I'd be looking for is, obviously, everybody talks about you have to have a sales process, right? But I always look at it as, in order to have an effective sales process, you need to understand the buyer's buying process. And so how does the buyer go through evaluating to making a purchasing decision? Is that something that work would do for me?
It can.
Yes, it can. Yes, 100% it can. Go ahead, Barbara. I'll let you.
Yeah, I didn't know who he directed it to. So I'll be the other square, Hollywood square in the corner. Yes, it helps to then you inform both things, because the buying process then comes into effect when you start talking about who are all those people, but what's the process then? So you ask the next logical question.
Yeah. Mike, I'll bring it down to I've already given you kind of one core piece of what we talk about, say versus do. Well, a big part of what drives do is the veracity of the challenge. Okay. The veracity of the challenge is really what drives do. If people really feel passionate about the pain, the discomfort, the inconvenience, the 10 extra steps the current process has me taking, they will move. If the problem is not so big, we're dealing with a major company right now that has a product. This is a top 15 company in the space. They've had a product for years. We're working on a voice of customer. They've had it out there. They can't figure out why there's not significant uptake. And basically what we found is customers say, we really like the product. Customers say, we really like the features and benefits. But then when we evaluate the challenges of the problem that the product is facing, they aren't so passionate that it's a major problem. And now you don't have a driver to change. That's that do dynamic. That's what we talk about, that say versus do dynamic. You ask them, do I like the product? Yeah. Do I have a problem? Yeah. Is this product going to address features that I like? Yes. Now tell me about the problem. Yeah, it's a problem. Not going to get me to move.
So I absolutely love that. And you have to run into this, right? What about if I develop the product? It does solve a problem, but it doesn't solve a problem that really is important enough for people to care. And then that value analysis or that study comes back, and there really is no way to re-engineer that product. It is what it is, right? That's still hugely valuable, right? Because that means you kind of want to get out of that market and start reshifting some resources in another area. And there's a lot of people that would say, they don't want to know their baby's ugly, but then you can actually make a new baby.
But is there a pivot point to the product? Does that?
Well, first, could you first do that? But there's got to be times where you find out, yep, the baby's ugly and it's going to be ugly forever. You might want to look to have another kid.
Yeah, right.
I mean, that goes way to market research, way at the beginning, because it's really important, but is the market like this or is the market like this? And then you have to know where that slit in that market is in order to get that market. And then maybe you make other iterations of it, but you might still be able to be successful. But then that all goes to your plan you've put together about your, return on investment and that sort of thing.
I think
The work that you do, Scott, I want to get your opinion because I know you do work a lot with customers and voice of customer and things of that nature as well. What's the most overlooked voice that's not heard in the chain?
Yeah, it's a great question. I mean, we talk about there's 4 voices in the purchasing process: clinical, financial, operational, and IT. Which, if you got something tech related, I would say a lot of times it's the financial piece. So we're not taught, like most people don't want to talk to a finance leader or supply chain leader that cares about the P&L because they don't want to have to answer the hard questions. And so, if you think about most medical devices, we're rock solid when it comes to clinical. We're probably really good when it comes to operational, how we put in a workflow, that sort of thing. But like the crux that I've seen, and I've seen this both, as a member of the manufacturing organization, running a big chunk of supply chain for a large health system, and then now as an advisor to medical device companies, people don't want to have those have what is perceived as the hard conversation around finance. What's the value that you're bringing in terms of dollars and cents? How much is this going to cost? How does it compare to competitors? That's it's basically like, realizing that your kid probably has funny shaped ears or something, and you don't want to get a haircut so you can see them. Like, that's the reality of it.
Hey, Scott, I just want to add something to what you're saying. I believe there's actually a rebalancing of the CFO paradigm today. What you talked about was the I actually don't believe the financials in the deficit today.
Okay.
And I'm basing this off of a couple of different CNO panels we've done recently. The CNOs, their main thing is their labor. And labor today is more strained than ever before. So what we're seeing here is, at least in my opinion, it was probably a 60-30-10 split. You always had to have clinical. The outcomes better be there. Financial is probably 30. You had to have a compelling financial piece. And operational, it just had to work, right? The way it was designed. Today, it can't work the way it's designed. It has to work to be easy. Easy to adopt, easy to incorporate, easy to do without having a ton of training, easy to do if you come in and train my staff of 5 people today and 4 of them all quit tomorrow, can I bring in their 4 replacements 2 days later and get them trained on it? Because if they can't, then as great as your product is clinically and as much as it's saving, I don't have any bandwidth to deal with that today, right? And I think there's a rebalancing. I think we're probably 60. 60 is never going to move. It has to be, the clinical outcomes have to be there. But I think we're having a balancing amongst that remaining 40% in some capacity.
Yeah, I mean, I think you're right. It's, from my perspective, it's more that companies, if they're doing voice of customer, don't want to want to avoid the people like a CFO, a VP of finance, that sort of thing, because those are the folks that they're not always the friendliest of folks. They are very focused in on the dollars and cents and that sort of thing. And so, back to Mike's question of like, who do people need to talk to more? I think they need to talk to the finance people more. I totally agree that we're definitely seeing, and have been over the past years, CNOs focusing more on labor. It's about the importance of workflow, that sort of thing. But we've seen historically people have interviewed CNOs to know that. It's just that the results are changing. Most people avoid anything finance related like the plague because they don't want to end up being told that, hey, your thing cost 50% more than it should, that sort of thing.
But what the CFO wants to hear is the CNO or whomever telling the CFO, here's what our situation is. Here's how this will help us with that. And they're bringing it to the CFO. If you start out with the CFO, they may like all the dollars that they see, and then they try to convince something internally But if they don't all get together internally, they may not see all those different C's and F's and O's that need to happen. So if they get someone internally.
Barbara, that's a really interesting sales strategy. So is that like something that you would recommend to somebody to say, we build an internal champion first and we use that voice to be the overall voice and we arm that voice to speak to the needs of the other constituents in the decision?
Yep.
Yeah.
Super cool.
Again, I think the operational workflow today, just we're hearing people are, again, we have 19,000 in our, and all we constantly hear is true exasperation. Just exasperation. And I was telling somebody recently, I was talking to an oncology nurse, and she was telling us how, she had to keep postponing a discussion that we were having throughout the day. It's because she showed up to work. She was the only nurse to show up. She had one oncologist on staff. They saw almost 30 patients in that shift. Okay. 30 patients in that shift. And I said, is that abnormal? And she said, for two people. And she said, it's becoming more and more normal. The reason why is with every time we have that, if we have our normal staff of 3 nurses and 1 physician, we're staffed. Problem is somebody always calls out sick. And then so what happens is now that person gets especially burned out. So the next day they call out sick. And we have these rolling periods of times where everybody's calling out because of mass burnout, and it only exasperates the exasperation in this perpetual wheel even further, right? And that's why I'm coming back to this operational component. There are so many products that we know right now that are sitting in massive queues for supposed adoption. They're never going to see the light of day because they already know they take 3 more steps to implement than the current product. The outcomes may be better, the finances may be better, but they're never going to get it adopted in the organization because as soon as one of those physicians, techs, nurses are like, wait, 3 more steps? I don't have time for it.
How does what you're seeing today compare to like what we saw back in what was like 2022 when we were dealing with the staff shortages?
It's so right now, I think back then it was kind of the awe of it happening with such veracity, right? Because it happened so fast, so hard that people were just stuck in a deer in headlights perspective. I think now there's a quasi numbness to it because it's been so prevalent, right? And people are just almost expecting a good chunk of their staff to turn over, right?
Yeah.
And they're almost preparing for the thought that, yeah, we've got this staff. This is great. We have 30 people in this department. This is fantastic. They already kind of know that within the next 3 months, they're going to lose 6 of those people. Yeah. Right. Whereas 7 years ago, they weren't thinking that. Does that make sense, Scott?
Oh yeah, I think so. And I think this is just the world that we live in now, right? Like we lost a bunch of nurses around COVID time and it's like we've just never caught back up.
No, and physicians are in higher demand than ever before because we're losing them at a rapid pace, right? I mean, I think pre-COVID, we're at 850,000 physicians. I think now we've dipped well under 800,000, and it only looks like it's going down. So that's a significant challenge.
So I know we have about 10 minutes left. If someone was to say they're listening to the podcast and they're saying, holy moly, I haven't done any of this kind of outreach to understand what's going on outside of trying to sell somebody something. What are some good first steps that someone could take to start to build the infrastructure they need to have a better understanding of what's going on outside the market?
It's really a sales and marketing 101, right? Start to build your buyer personas, right? It's really should be sales and marketing 101 is who is the end user, clinical. Okay, well, it's not, let's be honest, it's not just a surgeon. We might all say orthopedic surgeon, but it's not. There's a tech in the room. There's a nurse in the room. They usually have some sort of influence over it, right? So right there, you've taken your first end user persona and stratified it into 3. Then, because nothing is being made in just a universal decision, those 3 people don't have it. You've got to find out who's the head of a department. Right? Sometimes it's the lead tech. who's making the primary decisions to enter a code into the system, lead tech. Then you've got to start to go up above them, supply chain, value analysis, right? And identifying, how do I speak to value analysis? Because if you come in screaming about, the wrong thing to value analysis that they believe, I'm going to pick on OR, and I'm sure Barbara's going to laugh, but how many products do we hear about cutting down 8 minutes of OR time?
Yeah.
Right.
Yeah.
So, that may sound like a cool thing to that surgeon and that tech, but in value analysis, it's white noise because they've been hearing the same argument for 20 years. Right.
Mm-hmm.
So you better pick a different lead point to come to a Barbara if you really want to get her attention. But really, step one is just buyer persona segmentation.
Mm-hmm.
How do you do that? I mean, do you think that companies have that knowledge internally? Like how much time should they think about building out some of these?
You start off by having a conversation. That's it, right? I mean,
Yeah.
go to a surgeon and just ask them, hey, who else is in the room with you? When you want to bring a new product in, what is the process like? If I convince you this is the greatest since sliced bread, can you cut me a check right now?
Mm-hmm.
No, you can't cut me a check. What does it take to go from the process of me convincing you that this is a great product to the point that I get paid?
Mm-hmm.
Who do I have to figure out is involved in all those steps, right? You don't have to invest in a company like mine to do that first thing,
Mm-hmm.
right? But I will tell you, if you go to any surgeon right now and he tells you, yeah, absolutely, I can use this tomorrow if I say so. Okay, great. But can you get me paid for it? Yeah, that's silly. I can't do that. Right?
Or, I thought you'd provide it free for a couple.
I thought you'd provide it free. I thought it'd be a free sample. Great. Okay, yeah, maybe I'll provide you this one as a free sample, but I'd like to get paid for number 2. Oh, I can't. That's silly. I can't do that. Right?
You know what, Skinner?
Who do I have to talk to get that?
So, Skinner, you just said something just so cavalier, right? You just have a conversation with the doctor. You just have a conversation with the chief nursing officer. And the reason why I say it's cavalier, I don't have access to those people. I don't know a chief nursing officer. I don't know the radiation oncologist or whomever it is that I'm an engineer. I figured out how to build a linear accelerator that maybe is better than the best, but I don't know anybody. So access to people is also something that you need in order to have the conversation, right? And that's why you would hire you or Barbara or Scott, right? It's because if you don't have that, because the thing that I think people do is, and why maybe they don't get the right voice, is they don't have access to the right voice.
Well, I think they're not using the right means to find that access, right? We exist, Barbara exists, Scott exists. Those resources exist out there. I think some of it is an attitude of, I'm going to try to do it myself, but then that's where taking the shortcuts early lead to long-term detours, right? We all know it. It's a thing. There's a reason.
Yeah, and that's why I really just wanted to emphasize it for the audience, because speed is key. And I mean, for anything, if you're a startup, you're burning cash, right? You're not making money. So the faster, you have to get to break even. So if you're going to mess around, cold calling, trying to get a surgeon to hear your value proposition, probably not the best thing to be doing.
Mm-hmm.
The other thing is, and I've said this on a podcast before, it might have been last year or the year before, but join professional organizations in which you're trying to sell into. There are affiliate memberships. They don't cost very much. You could do it yourself versus your company paying for it. But you then get access to materials. You get discounts to attend meetings, but that's where you network. You don't even have to have a booth. Sorry, organizations, because I know they live and breathe by those, but sit down and have a cup of coffee, or you're sitting at lunch or something, and the table is a valuable thing. I've been to so many conferences this year and met so many great people that I could follow up with them and ask them their opinion. If they're a provider, you were talking about X, and I'd like to learn more just to educate myself, or there's a supplier there and we learn about something we never would have heard about because there's no way we can either see or make appointments with every supplier out there. So there's all these ways to network and get into really getting to know people and what they really need and things. So you have to be proactive and not just think it's going to come to you easy.
Yeah, I also think, and I know we got to get some final thoughts here in a second, but just to add in, I think that people overthink how complicated this is. I mean, Barbara, you make a great point. If you live in or around a major city and you're trying to get in touch with radiation oncologists, there's probably a St. Louis chapter of the American Society of Radiation Oncologists. And I could find out when that is, and I could show up. Yeah. And I don't have to show up too many meetings to start to meet radiation oncologists. And I think it's not necessarily the most convenient, but it is certainly the most valuable way to go about starting to get that. Yeah, you could hire any number of people to like help you get that voice of customer. But a lot of times, if you're a founder, you just need to you need to hear it firsthand. And the only way you do that is by going out there and being social with the people with whom you're going to be working with if you launch this company or grow this company. So I think you can't overstate the value of having some level of ties in the space, and you can get it just by being a little bit more extroverted than some of us may be.
And I want to add something to that, Scott. One of the things that I think is always confused about is everybody believes that somebody else always has the answers. Everybody believes that somebody else already knows. What I will tell you is we're working with a major healthcare provider right now who is in the face of some legislation around a particular specialty. And we're doing a massive voice of customer project for them because they want to know what other people in other parts of the country are doing to address this, right? So we as vendors think that, oh, what is the provider world doing? They don't know either. Everybody has a myopic viewpoint. We can all benefit from some external voices because you live in this world where everything becomes tunnel vision, no matter where you are. And having somebody from outside either validate or tell you there's something completely way to look at that same problem has benefit. So it's not just a medtech issue.
Well, Skindle, think about it. It makes total sense to have an external viewpoint about your product or service being done to your customer base, because the people, if you're doing it internally and they're saying bad things about things that they're responsible for, they could have addressed, guess what may not be reported, right? So it'll be really, so you want it really to be an honest evaluation and an honest voice.
Exactly.
So I know we're at time. I guess let's go around the horn and just give our final thoughts. Barbara, you want to kick us off?
So based on the conversations we've had and what Skinder and Mike just said is you got to go out there and you got to listen and you got to ask questions. You got to network. You got to find where that is and pay attention. But be an influencer also within your organization that you're actually trying to sell something, because they need to listen to what you're hearing as well. So it's a lot of listening, but a lot of conversations internally and not just a top down and say, no, this is what you need to sell. Let's talk about what's going on. And the sales team is the closest to your customer than anyone else. So you have to put in that effort to be collaborative within your organization.
Mike, you want to give us some thoughts?
So the way I always think is if I was going to climb Mount Everest, and I'd never do that, by the way, but if I decided that I wanted to do that, I probably wouldn't read a book and watch a video and then decide to go climb Mount Everest. I'd probably want to get somebody who's been to the top many times and who has helped people and actually saved lives during the process after I did my diligence, because my success rate would be a lot greater. And in the business environment that we're in today, it's extremely difficult. I don't care if you're selling $100 bills for $50 and they really are no counterfeit. That's the real value proposition. It'd be difficult to do that right now just because of the time that people have, the stress levels, the lack of staffing, all the other reasons. So when you're talking about this really important piece about positioning your product, service, or company, I'd be hiring my Everest consultant. I'd be getting I'd actually talk to one of these people or find somebody else. But I do think that what I like about this format is you get to hear the experts about how they approach things and why they approach things. And if you like their style, then yeah, you have familiarity with how they think and how they execute. So I'd go find yourself an expert on this one and help you out.
Gander, what do you think?
Yeah, if I was going to climb Mount Everest, I would also look for a great consultant that had tremendous new additives like Cellflow and supplements to help me get into shape. So I just want to state that as well.
Cheers to that.
Make sure I get on a good supplement regimen. It's so easy when you're in any process that you have committed your mind to want to hear the things that you want to hear. But the things that are going to save you so much frustration and consternation, because the entrepreneurial or the development, it's not even entrepreneurs, it's just development journey is so rife with strife that if you don't hear from the people that ultimately need to be your partners in this, the decision makers, the buyers, the users in some way, shape, or form, and you don't acknowledge that it is a herd mentality now, a community mentality, a committee decision-making process, you are just adding frustration to your own life. And so why wouldn't you just bring in those external voices earlier, make life easier, and make your process a lot smoother?
I think we've had some great insights. My last piece, and I'll piggyback a bit on what you just said, Skinder. I think at the end of the day, we've heard about garbage in, garbage out, and you can also say good in, good out. I think many organizations don't see the sort of the research or the voice of customer piece as an ongoing effort. And so what happens is a business's perspective gets stuck in a point in time. And that point in time may have been at the company's founding. It may have been 5 years ago when you did the last market research study, but it's not today. And so I think that what we're seeing with companies is intelligent ones have an ongoing non-sales conversation with the marketplace to understand how are things changing, who's gaining and losing the juice when it comes to getting a yes in terms of adoption, things like that. I think that that's an underappreciated and rarely overvalued activity to have a sense of what's going on in the marketplace. It's so valuable to know that. So, which again is why some of these activities are so critical. I guess, Skender, since this was to a great degree an interview on, and again, you got a deep depth of understanding in this. If folks wanted to learn more about running a study or things like that, what's the best way to reach out?
Yeah, please feel free to reach out to our organization anytime, www.the-clinx.com. That's THE-CLINX.com. We are happy to help provide any insights we can.
Fabulous. Well, thank you all for listening. This has been another episode of the Medtech Business Academy brought to you by the Medtexperts. Don't forget, if you haven't yet, be sure to like and subscribe so we can continue to deliver super valuable information to you, and tell a friend. So thanks so much for listening.
Thank you.
Bye-bye.